In 2003, we had SARS. In 2012, we had MERS. And in 2020, we experienced one of the scourge of the 21st century, coronavirus, also known as COVID-19. Already, COVID-19 has claimed over 1,000 lives. Europe is battered. Ghana, only some few cases. A person posted on Facebook, we're all going to die by end of June. Are we going to die? Are we going to die?
My name is John Amwesi, a medical and public health professional with the School of Public Health, Department of Global Health at KNUST. Now, with regard to this outbreak of the novel coronavirus, we all know that it started in December in Wuhan, China, and it is an influenza type of virus thought to have spread from the fish market and other markets where they have live animals, and then the virus is thought to have jumped to human beings. Now, this is not unusual, and we have always known that there will be epidemics of infectious diseases, and particularly it is an infectious disease like the influenza. This is not the first time that the world is experiencing this kind of epidemic. There have been worse cases in the past. And what normally happens with these kinds of infections or pandemics is that the number of cases go up, some die, some recover. But what we seek to do is to, as much as possible, reduce the number of people who get infected and also thereby reduce the number of people who die. The fear is from getting the disease, but the real focus should be on how many people are dying from the disease, what's the risk of death from the disease, and what categories of people are dying from the disease. So what we are trying to do as public health people at this time is to try and, we describe this as trying to flatten the curve, which is to reduce the rate at which it spreads, to reduce the number of people who die from it. What this means is that the epidemic or pandemic may last for slightly longer, but if it is left to take its own course, what will happen is that the curve will shoot up. A lot of people get it. Those who die will die, and will quickly die out for itself. So what we're trying to say is that even if you should do nothing, the probability is that this disease will go away by itself.
Professor Sam Newton, Head of Department of Global and International Health, School of Public Health, KNUST. When you look at the science, even in a place like China, where we are talking of 3 to 4% mortality, they have issues there. They have more people living to very old age. Apart from that, lots of people smoke. They have very bad air pollution issues there. And here we are talking about 3 to 4%. So we are not talking, it looks like the media is not talking about the 96% who recover. That's assuming the mortality is 3 to 4%. It will surprise you that maybe in a country like ours, or in countries which are similar to ours, the mortality could be around 2% or less. Now, when people are paralyzed by fear, then it gives rise to a lot of irrational decisions being made. Some people think that if you take in alcohol, or you take in this chemical, or you do this, it's going to help you. But the truth of the matter is that majority of the people who get this disease are going to survive. Now, let's be realistic. What's the life expectancy of people in our part of the world? Even if it's 63, 64, it's far less than in other countries where people live to 80, 75, 80, 90. And so a lot of our people would actually survive if they get this disease. And I think it's also important to make this point very clear from a public health point of view. It's not that we want people to be complacent, but we don't have to hype this issue of people are going to die unnecessarily. Others people are going to be paralyzed by fear. And once you are paralyzed by fear, then you do irrational things.
My name is Professor Ellis Ozudabu. I'm the Dean of the School of Public Health, KNUST, Kumasi. It is important to note that before you institute measures, one has to be clear on the rate of infectivity. So for all those primary cases that have come in, we call them index cases, what is the degree of infectivity? In other words, when one person has this condition, how many people do they infect over time in Ghana? We don't have an answer to that question. And therefore, what I'm suggesting is that it's important that we understand the science to institute the intervention measures.
I'm Dr. Ati Singh, public health physician from the University Hospital, KNUST. We should maintain social distancing. It's very important because that is one of the main ways we can really prevent the virus from spreading from one person to the other. And of course, we know the distance is about 1 meter to 2 meters. So
actually, Guinea, Sierra Leone, and Liberia, I saw these treatment centers with my eyes. What did the trick was people following basic sanitation, hand washing, hand sanitizers, not sharing fomites, and just doing the right things. And the disease went away literally by itself, even in situations or systems that are much worse than ours.
If you have been to an exposed area where cases have been reported, we want you to stay within your house, room, whatever. Don't interact with anybody for as long as the duration of the incubation period of COVID-19, which we know now to be 2 weeks. So for all those people, they should stay indoors. If you came with a parcel, whatever, a bag, whatever for anybody, please stay indoors. Don't contact all such persons.